Hi everyone, I'm Emily Smith. I'm an Australian podiatrist and the founder of Emily Braidwood. Anyone who knows me will know I love wearing high heels, and I have always been an advocate for helping my patients wear the shoes they love whilst mitigating the risk. I have spent over 13 years working alongside highly experienced sports physicians, physios and orthopaedic surgeons within 5 highly regarded sports medicine centres in Sydney. I have extensive experience encompassing teams including the Wallabies, New South Wales Swifts, GWS AFLW, Bangarra Dance Theatre and New South Wales Institute of Sport, as well as elite individual athletes and high-level corporates. With a mission to redefine high heel comfort since my final year literature review, my diverse multidisciplinary experience has allowed me to observe and collate clinical patterns, establish and test theories, then test and refine insole prototypes. A decade later, the Emily Braidwood Footbed range was born. I founded Emily Braidwood with a simple philosophy to pioneer sophisticated, podiatrist-designed insole products that empower the patient and the practitioner with innovative solutions. We have developed 2 patented products, the EB Flats and the EB Stiletto insoles, which I prefer to call footbeds. Our products are designed to go into all styles of fashionable shoes, including open back, open toe, sandals, ballet flats and boots. They are also skin stickable with use with a grip sock for Pilates, yoga, gymnastics, bar, and also in slimline sport-specific shoes such as spikes, football boots, and dance shoes. For high heels to date, there has been extensive study on the effect of high heels on the musculoskeletal system. Dr. Douglas Ritchie has summarised these succinctly in his 2018 paper, Heel Elevation in the Shoe, What the Literature Reveals. As a highlight reel, he identifies that the body accommodates for additional heel height with anterior rotation of the pelvis, including lumbar lordosis, which increases the compressive forces on the lower back and increasing erector spinae activity, hip and knee varus, increased abductor demand, increased medial knee compartment pressure, increased ankle inversion, inverted rear foot, increased load on the first metatarsal head with pronation of the forefoot, increased ankle instability, 2 times increased peroneus longus activity, increased ankle plantar flexion, which causes increased knee flexion, which causes decreased length and tension of the gastrocnemius, with the medial gastroc loaded. With a 4 to 7 centimetre heel, there is reduced functional stability, postural changes and change in muscle activity, which leads to loss of balance. Also, there's a shorter stride, lower step frequency, longer double support phase, and an increase in forefoot load. This recent literature review identifies a very similar trend to my preliminary Emily Braidwood research findings. However, much of the prior research focuses on increased peak force and the change of centre of mass, where approximately 70 to 90% of body weight is placed on the forefoot in a heel. The higher the heel, the higher the peak force. Makes sense. However, because I had trialled all the forefoot pads, insoles and gel cushions on the market, plus had made and tested bespoke forefoot pads made from Poron and EVA without any significant change in comfort, I figured that there had to be another biomechanical factor at play. My breakthrough came 5 years after my final year research project, with the aftermath following my wedding day. It became obvious to me that in a heel over 4 centimetres high, the windlass mechanism kicked on and stayed on to supinate the foot. With the foot in a supinated position, the peroneus longus and brevis are heavily recruited to maintain a neutral equilibrium, leading to the additional load through the first metatarsal head, hence the formation of a high arch and the pronation of the forefoot. Once the peroneal and calf complex fatigues, the secondary ankle stabilizing muscles are then recruited to take the load, leading to toe contracture and fatigue of the extensors and the flexors. We found that the time to fatigue and therefore pain was highly dependent on the wearer's muscle conditioning and strength, as well as the innate stability of the shoe. That is, if they're in a thicker versus a thinner heel. A simple way to demonstrate the stiletto effect is going into an isometric calf raise barefoot. Just like in a heel, as you move onto the forefoot, the hallux and lesser toes dorsiflex and the metatarsals plantarflex, with the plantar aponeurosis engaging as it winds up around the first MTP joint once the heel is approximately 4 centimetres off the ground. The plantar fascia pulls on the calcaneus and shortens and raises the arch and inverts the subtalar joint. If the person performing the calf brace corrects the forefoot position to place the majority of the load through the first and second joints using correct engagement of the perineals and calf, the rear foot will take a more neutral alignment. However, as the perineals and calf muscles fatigue, it is increasingly challenging to maintain and prevent supination of the foot. My findings generally fit with the prior research. However, I believe I am the first person to attribute the windlass mechanism as the key underlying biomechanical principle to high heel dysfunction. Having identified supination as the underlying cause of high heel pain, our patient footbeds are engineered with Medigel and Hexagel. The majority of the body of the footbed is made from Medigel, beginning from the rear foot valgus post to support the lateral foot and ankle, unloading the peroneus longus and brevis, as well as slowing down the lateral shoe wear and displacement. The lateral support extends down into the forefoot, transitioning into the Hexagel pods, bringing the ground up to the foot at the fifth metatarsal and balancing the forefoot valgus position. The graded multi-height Hexagel pods also have an intrinsic metatarsal dome to provide forefoot comfort as well as prevent toe contracture and deformity. Mild arch support is added to maintain optimal alignment and support women with highly flexible flat feet. In addition to the Emily Braidwood stiletto insole, which is suitable for any heel over 4 centimeters, we have designed the Emily Braidwood flats insole, which is perfect for any style of shoe less than 4 centimeters. Unlike any insole on the market, our patented footbeds balance the foot from heel strike to toe off by minimizing over-supination at the heel strike, providing adequate midfoot support during mid-stance, and facilitating optimal transverse axis alignment at toe off, getting that nice high gear toe off as the patient or the person progresses forwards. The EB flats have all the features of the EB stiletto. However, there are 2 major differences. The EB flats has a moderate arch support to provide additional arch contour to balance the foot and prevent overpronation. The contour is high enough to be effective and comfortable, however low enough that it won't cause slippage of the foot. The heel aperture provides a calcaneal deflection to prevent and manage heel pain. The heel aperture is the easiest identifying factor to differentiate the flats from the stiletto. The Emily Braidwood flats work really well in all forms of dance shoes as they prevent sickle of the foot, provide shock absorption, and promote optimal alignment without restricting range of the foot. They also work beautifully in running spikes, waffles, and football boots, where the shoe is too shallow and tight-fitting to accommodate a customized orthotic. So some of the other questions that I get asked about how to prescribe and use the Emily Braidwood products. So when to choose EB flats over EB stilettos. If the person wants to wear any heel less than 4 centimeters, we would normally choose an EB flats. If the person has a really flexible flat foot, up to 5 or 6 centimeters, we can get away with the EB flats product, but above that, we really don't want to be adding too much arch support into that shoe. So in that case, we would then add in the Emily Braidwood stiletto as well. So to use the product, what we do is we take the plastic off the bottom of the insole, keep the plastic if you want to reuse it, place the insole slightly forwards of the back of the heel so that you can see a little bit of the detail of the shoe if you would like. Otherwise, you can have it right back at the heel, and then simply smooth through from there. So you do want to line up, in the most part, the forefoot. If the insole is a little bit narrow for the shoe, you can pick a side depending on where the patient is, experiences more pain. So it should simply sit in there in a really nice slimline fashion, and there shouldn't be anything that you can see at the toes. So to use it in a shoe where you actually don't need to take off the plastic, we can use the insole without taking off the plastic, popping it into the back of the heel, and then basically the patient just needs to hold the insole at the back of the heel before they slip their shoe on. To remove and reuse the insole, we basically peel it out nice and carefully, pull it through, and then it's ready to go into another heel or another shoe. If the insole loses its stick, simply use a couple of mists of water onto the insole, let it dry, and then it will become tacky again before it can be reused. To use it as a skin stickable device, basically what you do is you put a left, so this is a left insole, we're actually going to put this onto the right foot, lining it up from the heel forwards, and then the right one will go onto the left foot. So we then use a grip sock over the top of that to hold it all together. So great for Pilates, yoga, and different forms of dance where they're purely barefoot. The EB flats and the EB stiletto can both be customized using a foam or an EVA that is adhered to the dorsal surface of the device. So I like to use the foam to add on to a little bit of the metatarsal arch, or whether or not you wanted to add a little bit more arch support to the EB flats, that's certainly doable as well. You've just got to be careful that you don't add too much where the foot is actually flipping out of the back of the shoe. For optimal patient outcomes, the Emily Braidwood footbeds are best prescribed with progressive calf raises, performed with a high gear form and reps only to fatigue, calf complex stretches, perineal and extensor complex stretches, plantar fascia self-release and massage, intrinsic foot muscle strengthening, footwear advice including optimal heel height, customized orthotics for sports shoes, load management advice, balance and proprioception training. So that's about it for our product. However, I would love to run you through some of the features of Emily Braidwood, our brand. We run an On Point for Purpose campaign where we donate 5% of all our retail sales to a charity that helps empower women to become educated and employed. So at the moment, we are proudly supporting the Kathy Freeman Foundation, and all our sales that go through podiatrists will be going to the Kathy Freeman Foundation. Also, we do offer a money-back guarantee. So basically, your patients can trial their insole products for 30 days, and if they're not super happy with them, we will give you your cost price back, and you are then expected to refund them the difference. If you have any questions about that, please let us know, and we're more than happy to help you out with that. So that's it from me. Thank you so much for listening. If you have any questions, please reach out at emily@emilybraidwood.com or check out our website, emilybraidwood.com, for more information.